Had a fantastic introduction last week with the honor of Rabbi Weiss Shlita. Today will be more of an overview introduction. And I think that what's important is what Rabbi Weiss Shlita calls the spirit of halacha, the spirit. What was the Ritzayin Chacham? What's the Ratzon HaTorah? We sometimes get lost, in the details, especially as dentists. So where are we trying to go here? We'll look a little bit at some of the topics that I mentioned we'll be covering over the next 10 years. And I thought the Sefer was totally comprehensive, but I found that many areas such as Choshen Mishpat, taking credit cards, giving discounts up front is not included from what I saw. Other Yodea, and we'll get to them. We have the great honor next week in Mitzvah Shem of having the author, Rabbi Dr. David Katz, will be here in Israel, so he will be here, so if you have any questions or whatever. But again, Rav Asher often turns back to the what's the Ratzon HaTorah here? And it's a fine balance in today's topic of basically of dental treatment on Shabbos and Yom Tov, is on one hand finding the healthy balance between respecting the human being and respecting Shabbos. And sometimes when serious enough, Shabbos sort of takes a back burner, takes a back seat to the needs of the human being, of the individual. Mitzvah l'chala. And like the Ohr HaChaim says, this is not Chilul Shabbos, this is Kiyum, this is Shmir Shabbos. And sometimes the person has to take a back seat. And I will repeat, is there anybody who wasn't here last week? Okay. It's so dear to me, the analogy, that I'll bring it again before we cover the topics and hear a few words from Dr. Rosner. We need to, as the Sefer points out, stay within the parameters of halacha. I always say that halacha does not paskin emotionally, but it definitely addresses the emotional needs. And Rav Asher, even more so in 2018, in Tavshinai Ches, sees the emotional component as a very serious need, to the point that sometimes the psychological need becomes the pressing need, such as elective plastic surgery, such as orthodontics and tefillah. And we'll find very often, I think, another very important point as we look at the halachas one by one, and each individual will find, their comfort zone of the way they would like to go and how they would like to present it to their patients. But I think that in many of these areas, we're going to find that we're mitzaref many coolers. We're mitzaref many coolers to enable a certain level of kavod brius, to enable a certain level of comfort. But the individual might want to know that there's definitely makom lahachmir. I don't know if we'll impose it. So we have maybe three levels. Shalom Aleichem. We have one level where I would say for the most part, you want to use a toothpaste, doesn't need kashrus, doesn't need kashrus. There's plenty to rely on, as we'll see. But a person would like to be machmir, he's putting in his mouth something that's coming from an animal source, is the makom lahachmir. If we say that the granules of the bone graft, which is the stimulation of the Sefer, when these new bone grafting materials came out, and I have personal correspondences with Rabbi Yashiv Zatzal on this, is, well, let's say we could say the granules are so small and they're not mitzaref, and tumas goy is not bamaga, which is not lechatchila, so that a student could go and study dentistry or medicine, etc., etc., etc. We take 10 coolers and we burn it down with acid, etc., etc. But guess what? If you're a Kohen, you might want to know there's an issue. So the second level will be, what about if the doctor is a Kohen or the patient? Now, what if the doctor wants to be machmir, but the patient needs the bone graft? A third level, I think, which is very common for us, is do we have to drive every patient nuts with every shiur? Now, we get many patients who are not sensitive enough to ask a shiur. They are shomer, Shabbos, maybe not even, but they may be shomer taras and mishpacha. Do I have to say there's an issue with 3.0 vicryl resorbable? Is there a difference between if it's resorbable over a month or over a week? And if I have a tzad to be makel, well, then maybe I don't have to say anything to this patient. If it's absolutely awesome, maybe, yes, on my post-op form, la halacha, it just say you may want to know that there could be an issue and you may want to look into it. But it's part of your form consent. This is what I want. It's first close of the Eva. It's mamish leivner. It's beyond the Eva. It's mamish your Messiah is very here. the example I brought, which I think is beautiful, we brought it last week, and I'll bring it again without belaboring it, but I think it drives us through the entire study that we'll want to have on the issue. If a person is going down a mountain with his car and he loses his brakes and he goes straight, we said last week, and chas v'shalom, he'll kill 5 people. But if he doesn't act and turns left, he'll kill only 1 person. It's a tshuva nechzonish. And if he turns right, he'll kill nobody but himself. Does he shave al taisa, just go down the hill? Does he turn left or does he go right? Rav Kaplan Shlita asked Rav Shlomo Zalman Auerbach Zatzal. And Rav Shlomo Zalman said, well, what would you do? Call me on your cell phone when it happens? He says, well, I don't know. So he said, well, if you don't know what you have to do, then you don't have a license to drive al pi halacha. And so I would say that if we don't know these halachas, in many ways, we don't have a license to practice dentistry or medicine al pi halacha. And we could think about that. And I think it's our responsibility. Another issue I want to bring is that I didn't see one topic in entire Sefer that's not universal. If you took out the word teeth or dental, like people said to me, who came to the shiur last week? I said, well, there were 3 types of people in the shiur last week. There were dentists, about 50%. There were people with teeth, and they were about another 30%. And then there were people who were not dentists and don't have teeth, and they were about another 20%. And somewhere in the middle. So who is it not pertinent to? And what halacha in Orach Chaim, in Ebenezer, in Choshen Mishpah, Yerdea, is not universal. Pluck out the word tooth, and these are universal concepts. Otherwise, Dr. Rosner wouldn't be here. What does he care? Just because his son is a dentist, his other son is one of the biggest Magidi shiurim in the world in Daf Yomi. He has what to do. But these are universal concepts that we're always learning. And I think that one of the most beautiful verses I heard from Rabbi Elazar Abu Chatzir Zeichat Tzadik Levracha was Talmidei Chachamim Mardim Shalom Be'olam. He said, if you go to Hadassah, if you go to the wards, you go to the hospitals, you don't see shalom between the chairmen of the departments. Talmidei Chachamim, those who continuously consider themselves Talmidim, wanting to learn, between them you find. But between the Chachamim, you don't find shalom. We need to continuously be willing to learn. Look at Rabbi Shavais last week in the shiur. Awesome. He came here prepared to give us a chiddush. And if Dr. Stone wouldn't have been there, would have gone across Glatt. That pulling out a tooth because you don't want the bleeding, and then we said, yes, but we do want the bleeding, right? Some people want to make PRF with it, but whatever it is, we want the bleeding. On the spot, he didn't say, well, or he didn't, he said, well, in that case, I understand what the Mishnah Berurah was trying to say, and the Magen Rambam was trying to say. And so, this is the living Torah, the halachas can change. Or as Rabbi Feinstein Zatzal wrote to me 5 years after I wrote the Shilas, he said, you know, we used to paskin one way, but today we have B'nai Torah giving us insights into the dynamics of what's happening, is the halacha changes. And the point I'd like to make is that the halacha doesn't change. So for many years, after going through the halacha and Shulchan Aruch and a very long Beis Yosef, I stood during davening as a good yeshiva boy. I stood during Kaddish, only to find that if I looked closer, there was as much reason to sit, al pi Kabbalah, as to stand. As after many years I did tshuva, and I started doing what my father did. Zekeli Vanveo was beautiful, but okay, Aviva Rabbeinu, I wanted to walk my father's footsteps. I started pulling out the minhagim I picked up in yeshiva. And not only was there another side to it, but it was a very strong side. Well, you're going to confuse your kids. Your kids say, listen, Dad, Abba, you used to stand, now you sit. You're not consistent. And I teach them, no, I am consistent. Then I went through the Beis Yosef and halacha and did what I thought was proper al pi halacha. And now when I revisit the halacha, I'm again prepared to do what is proper and appropriate. And in most cases, it's about aseh l'charav. So the vistalik ben asafik. And as we approach Rosh Chodesh Adar, I always like to say, Mishenichnas Adar marbim b'simcha. Ve'in simcha katoras hasfeikos. Even Dr. Stone doesn't know where it says that because it doesn't say that anywhere. But there is a Ramah in the Tshuva that says, "In simcha kisfeikot v'ataratan." There's no greater simcha. So as we approach Rosh Chodesh Adar, we need to learn how to be matar sfeikos, and we learn the Pirkei Avos Aseh l'charav v'stalik ben asafik. So some of the topics we'll be dealing with, among others, and start today with dental treatment on Shabbos and Yontiv. We have oral hygiene on Shabbos. A lot of questions. Chuvas Ramosha about using a toothbrush. Well, maybe he was talking about hair bristles, natural bristles, and nylon bristles are different. Is there schita? Oral hygiene and dental fast days. Are you allowed to rinse out your mouth? I had a gadol once came to me, really a gadol, and I said to him, Olav Shalom, and I said, oh, it's Shivasa B'Tammuz, maybe the Rav didn't notice. And not only did he come, but the next year he made a point of making an appointment on the same day to teach us and the staff that not only that it's mutal chatchila, but there's an issue. Dental issues, of course, the chatzitza that most of us have encountered. It may be periodontal packing. Guess what? It may be the cover screw of the implant. We can't take things for granted. Koshering dental prosthesis. Why isn't the porcelain bolea? Why aren't the metal fillings bolea? We don't put yatsu lettuce in the mouth. You find a Russian or a Polish Jew who's willing to drink soup that's not yatsu lettuce bowl. And when you bite into a piece of kugel, a gush, we hold, is a klirishon, is how come you don't need milchik, fleshik, and parv? And there are those who say that the briskers don't do fillings for that reason. They pull out the teeth. Well, I asked the brisker Rav's daughter, I told this to her, she should be well, she's probably in the 90s today. She says, nonsense. My father never said that. It's not true. But in any case, the thought is there. The concept is there. Kashrus of dental products is a real issue. I was in Holland, and I saw a wealthy fellow from Holland offering me a Listerine sticker to his palate. And I just read the page over here. That most of them are pure treif. Is it a problem? Well, he had a special run where they made a kosher run. But is it an issue? Is it not an issue? Bone and tissue grafts, which is really one of the meat chapters of the Sefer, very beautiful. And it starts with cornea transplants. You know, way back when Moshe Paskin is shilas, he said, when you do a kidney transplant, you're killing two people. Okay, the person who's giving it and the person who's getting it. But things have changed, as Dr. Rosler, the statistics have changed. If Dr. Omar Reed in Phoenix, Arizona says, if you quote me, date me. Yeah, I did say that once, but now I say different, because things have changed. The study of medicine and dentistry, not a simple topic at all. Yes, we are makel maybe that a guy is not metame ba'ohel, but there's definitely makel b'machmer, and it's a kula because of the value. And we have a shaila here, I think it was to Rav Goren, about a student who literally would almost commit suicide if he didn't become a doctor. And he gave certain heterim in that instance. Let's say everybody agrees with it, but there are extreme cases. Forensics, do you have to bury teeth? Is it considered aver? We talked last week about reimplanting in a Vol's tooth, which are Moshe and Moshe Weiss both reversed the decision brought in Chazal that yes, you are allowed to. Shavlechem or Pasakov. All kinds of halachic. Here's a very interesting chapter. I found this chapter fascinating. Fascinating. Is Dr. Pasakov Machshel women when he puts on braces and they go. Now that you have Invisalign, should they consider it? How much do they have to pay to go to Invisalign? But opposite genders, this one I never understood. I brought 2 women dentists into my practice because my feeling was there's no justification for a man to go to a woman dentist and a woman to a man if they have the option. And I was shocked that none of my Toldus Aaron women wanted to go to the women. They said Mamanav Shach to themselves. They said, if she's a good doctor, she's a lousy parent. And if she's a good parent, she's a lousy doctor. And either way, I don't want to go with her. They didn't believe a woman. Now, is that psychological need enough? How the girls dress in the office. And I'll give you a very interesting one that came up. But something comes up all the time when they sit down and, forgive me, but if the skirt goes above the knee, is that an issue? Would it be better for dental assistants to wear pants? Interesting shilas brought over here. Or should they do both? I saw a tshuva once in Otzar Poskim that if your secretary, when he comes in, you know, you got a good one that's hanging around for a long time, and she goes, Dr. Rosner, with a little sing to it, a little tune to it. Or you ask her to get something, and she goes, Dr. Stone, and it says there to be machmir that it's called Kol Isha. Is it Kol Isha? Now, Moshe Shapiro Zatzal said that's nonsense, and absolutely not. It's derech of talking, but not everyone says it. We have problems with yichud that come up all the time. Well, we know there's a heter, Ba'alo Be'er, the husband is in the city. Well, what if it's choshkabo? What if you have a secretary for 30 years who's been the pupil of your eye? She's been a lifesaver for you. You're very close. You're very close. Do you still have the heter? And the answer is, officially, you do not. And so if you're in the office at night, and even if it's Ba'alo Be'er, it may not be. Here again, Moshe Shapiro Zatzal said to me, I'll tell you what choshkaba means. It means that if she's prepared to come in her house coat, in her robe to your office, that's, if not, it's not. Okay, but you need a gadol to be able to say something like that. What are the gedorim? L'chatchilim b'di'evet. And so it talks about sneers, cosmetic dental treatment, electric treatment. Are you allowed to use permanent lipstick? This was a new one for me, Dr. Rosner or Moshe. We went through the tshuva of Asher. It was a bit kiddush. Is that considered tattooing? Is that considered ketovet kaka? Okay, a permanent lipstick. And guess what? The law pretty much is you're not allowed to do it. Although I see here from the Sefer that it seems that most of them are semi-permanent. They're not permanent. Does that make a difference or not? So there are all kinds of issues here. So no further ado, before we start, the halachas of Shabbos, it may be a review for many of us, but when we used to ask Rav Moshe Feinstein a shayla, we used to say, Rav Moshe, we said, Rav Feinstein, is this and this mutter? And Rav Moshe always classically used to say, before you ask me if it's mutter, tell me why it should be aser. You know, just, everything's aser, okay? First of all, if you have a havina, and the reason is, because depending on why it might or may not be aser, will have an impact on why or not we can matter it. Should it be aser midaraisa? Should it be aser midarabbanan? Is it just an amir al-akam where you're talking to a guy in a daraisa, talking to a guy in the rabbanan? These are big nafkaminas. So before you say aser, but plastic surgery, or what do you mean plastic? Elective work, okay? Are you allowed to stitch on Shabbos only because there's going to be a scar? I was always very machmer in this. I mentioned this last week. What do you mean? You put a little a butterfly on it, it'll be fine. Put a little bacitracin, a little cream on it. I don't know anybody who died from a cut on the face. You're doing it because you don't want the girl to look at it. Rabbi Weiss has a big chiddush from the Miri and others that sakonas aver doesn't mean the loss of a limb. So Rabbi Asher, let's see Paskin. Do you have who to rely on? Yeah, we're sitting in his base measures right now. He says anything irreversible is called sakonas aver. Tremendous chiddush, but we need to see it inside. Not only, Yosher Ben Soloveitchik always used to say that not only do you want to know the bottom line of halacha, sure, you could go to the Chuvas and you could open up to the back page and read the 4 lines. Yes, Dr. Schrader asked if you need a separate pair of dentures. My answer to him was, he's a big Talmud Chacham, he's a fantastic dentist, you're not allowed to. You want to know the dynamics for 2 reasons. But one of the reasons is you want to know how to extrapolate. You want to know, well, based on this, even if you don't know the tshuva, you want to know what the shayla is. You need to know what to ask. I thought I asked everything. Last week, I had a fellow come to me in shul, and he said I pulled out a wisdom tooth by another doctor, and it's bleeding, it's oozing on Shabbos. Oh, I said, no problem, take a tea bag, make it wet, there's tannic acid in the teeth, it'll stop the bleeding. I said that to him on Shabbos, and he said to me, can I do that on Shabbos? And a bulb went on, because he was a shayla that I personally never asked. Does it work? You bet it works. Is that called derech achila? For sure not. Putting a tea bag, a wet tea bag, I know people who have tobacco bags, okay? Like snuff, like baseball pitchers they put on Shabbos. Are you allowed to do that? Is it a nicotine patch can you put on? Or other types of things. So these are many halachas. So before we go into yes or no, we need to know the fundamental issues. And there are basically 3 here as we approach the first halachas, and then we'll hear from Dr. Razda. Number 1 is, again, it's a hard one to grasp because the Torah wants me to suffer. How often on Shabbos we're in a situation where we just want to put a little bacitracin, a little cream on, take an aspirin, take something. And the Torah says, Zera mishum shtikas mamonim. No, you might come to prepare it. Well, how many people in this room know how to prepare it? Do we say today, Kivin Shabbat Latam Bat Lagzera? Nobody knows how to do it. And guess what? There are poskim who do say it. And guess what? We don't pass it that way. But B'tzirov, sometimes along with some other kula, it might be, and there are many examples in both directions. So the first one is, you're not allowed to take medicine on Shabbos. Number 2 is, Shabbos goes to the back burner when there's pikuach nefesh. So, if it's serious enough, and we have to have the gedarim of that, and Rav Tenla always used to say that nofel mishkav doesn't mean that you're in bed. It means that if you had a choice, you would be in bed. Isn't it interesting that all the staff in the office have been in bed many times during the years with you, and you, the doctor, have never been home in bed, or almost never. And that doesn't mean you wouldn't rather be in bed. If you, like your secretary, would rather be home right now in bed, that's nafel mishkov, even if you're not actually in bed. And the third one that's relevant for us is a tremendous chiddush, and Rav Asher Weiss dealt with this a little bit last week, is Makkah Shel Cholol. All of a sudden, we got this big thing in dentistry. And if we have time one day, we'll share with you, I think, a beautiful thought. But the Gemara says in Avodah Zarah that anything from Machlokas Rishonim, the lips and inward or the teeth and inward, is called sakana. Well, the first question I ask you as doctors, and when we start interacting a little bit, what's the Machlokas? Is it a technical Machlokas, a medical Machlokas? It's a Kabbalah, something spiritual, something in between? In any case, Makkah Shel Cholol is considered. Well, for who? Does that mean for a layman who doesn't know, but me, the doctor, I know? It's not. Or no. Chazal said it's a sakana, it's a sakana. My mother-in-law's sister in Romania died from an impacted wisdom tooth. There was no one in town able to take it out. We take it for granted. There was no one to take it out, and she died. So yes, you can die. I wrote to Moshe my 18 pages based on amazing sefer. I don't know who wrote it. Practical Medical Halacha, written by Dr. Fred Rosner. And that was my inspiration. And in it he writes about, I think he even brings it. I may be wrong, you'll correct me. But can you tell, today I said to Ramosha, we have Marcaine. I could give someone an injection and keep him out of pain for 8 to 12 hours. Come to me after Shabbos. And Ramosha answered, you're not allowed to do it during the week. You're not allowed to say, take 2 aspirin and see me in the morning. What does Dr. Rosner say all the time? It's not Shabbos, it's Tuesday. Whatever you would do on Tuesday is what you do today. Well, are there parameters to this Tuesday? Okay? There's Monday and there's Monday, Monday, and there's Tuesday and there's Tuesday. Should we still even try to avoid it, or is Tuesday only if you have to? These are delicate shilas. So I asked Ramosha, I said, if today that we have antibiotics, are all these things not considered pikuach nefesh anymore? And he said to me something amazing. And when I wrote this up in 1992, the world laughed at me. Ramosha said there are things we don't know. Chazal said it's a sakana, it's a sakana. Well, I mean, we have antibiotics, I mean, that's it. I mean, people don't die from mouth infection, from sapidna, whatever. Well, in the 1990s, again, thanks to Omarine in Phoenix, Arizona, I became familiar with something called prostaglandin E2, that the very material we use to enhance births, to get labor going, prostaglandin E2, is what the gums secrete. And now we talk about the oral systemic link. And all of a sudden there's stuff going on that has nothing to do with antibiotics. There's tumor necrotizing factor, TNF, there's prostaglandin E2, and all kinds of stuff that go on in the body that even if you're on antibiotics, can be pikuach nefesh. And in the Merck manual, in fact, it says that the PGE2 and all this stuff increases blood pressure, causes asthma, miscarriages, etc. To what extent? What extent does it have to be? Dr. Rosner, do you have anything to share with us? Any insights on pikuach nefesh or Shabbos before we look at the basic fundamentals?
The double murder that you were talking about, that Moshe Paskin was by heart transplants, not by kidney transplants. Kidney transplants is a machlokas between the Bavli and the Yerushalmi. The Yerushalmi says, Chayiv Adam sakenes atzmoi k'tzas kedei hatzilas chaveiroi shehu bevadai sakona. In other words, to donate a kidney, you have to, says the Yerushalmi. Why? Because your life is just in a little bit of danger from having the kidney removed, whereas the fellow who's on dialysis, who's dying of kidney failure, for sure, 100% is going to die. So the minority think, that's, we don't pass them like that. That's the Yerushalmi. The Bavli says, mutar. You're allowed to give a kidney. You don't have to, but you are allowed to if you want to be a good Samaritan. Now, the categories of illness on Shabbos, medical illness, are the same as dental illnesses. We have cholesh yesh bo sakona, life is in danger. Cholesh ein bo sakona, whereas life is not in immediate danger. Mechesh be'alma, just a headache, don't feel well. And of course, sakonas eva, the halacha is very liberal with that. If you have a tearing red eye on Shabbos, that's considered sakonas eva. Now, I had a neighbor who came to me on the second day of Pesach, knocked on the door. The wife knocked on the door, says, "Dr. Rosner, my husband's having chest pain. What do I do?" I said, "What do you do? What do you mean? You get into your car and you drive him to the hospital or to the emergency room." She says, "But it's Pesach, it's Pesach." I said, "What would you do if today was Tuesday?" She says, "I would get in the car and drive him to the hospital." I said, "So today's Tuesday again?" Like Dr. Stern said before earlier. And it turned out, Tucker, that he had a massive heart attack and he needed bypass surgery. But Baruch Hashem, he came home well. Now, in medical halacha, as in dental halacha, Sofik B'kuach Nefesh is also enough reason to be Mechal Shabbos. And I use the example, somebody's got an abscess on his arm and it needs to be incised and drained. And the surgeon comes and it's 4 o'clock in the afternoon on Shabbos afternoon, and he says, we can wait, the Shabbos will be over in an hour, so we'll do it afterwards. Says the halacha, no, you do it right now, because if you don't incise and drain it right now, between now and Shabbos eyes, the thing may burst and give a septicemia, and the patient's going to die from it. So that's a chodesh yesh b'sakona. So you do it right now. It's just an example of Sofik B'kuach Nefesh, and there are many, many other medical examples, and of course dental examples also. Anyway, those few introductory comments. Anybody have any questions?
Just on the note that Dr. Rosner mentioned, because it's really beautiful, was to me, as far as incising an abscess. There's a very interesting Magen Avraham, and in fact it turns out to be the first Reb Chaim Briska on Shabbos. And this is the way I learn it. And Rabbi Shavai Shlita disagrees with me, but you could look inside, but to me it seems black and white. I think it's just a little bit slightly different ways to look at it. And basically the question to you would be, if you have an abscess, assuming medically they're equivalent, I'm not saying they're superior to one, assuming they're both acceptable, is it better to make an incision the pus should come out, or is it better to press the pimple to exude the pus? So Dr. Stone, what would you say? Does it make a difference? Or
Medically?
no, if medically it's equal, assuming that it's not dangerous to stand in front of the mirror and pinch a pus pimple on your nose that'll back up into your cavernous sinus.
More so. That's the technical term.
Halachically, you're better off without the cut, but I don't think your example is realistic.
It's not mine, it's a Magen Avraham. But
No,
okay.
to say that, I think medically we know that you're
Yeah.
better off incising.
But I want to for the conception of the halacha. So
So
assuming
halacha, you're better off with the maybe smoke.
why?
It's Gemara Shabbat.
What's that?
It's Gemara
Yeah,
Shabbat.
what does the Gemara say?
Gemara says you're better doing a Memphis Muslim, not doing
Mapis,
a
what does that mean, Mapis Morsa? So Magen Avraham says Mapis Morsa maybe means.
You have to make
Says the
it
Magen
all big
Avraham,
enough
says
to
Reb Chaim Briska, that Mapis Morsa is malacha she'eno tzicha legufa.
Right, you're making it fair.
Inami, says Reb Chaim and the Magen Avraham, it's Dovid she'eno miskaven. What are they saying? What's the controversy? And I think this is the controversy. But what I was thinking, that there are two ways to be Mapis the Morsa. Is if you make the opening, but you don't want the opening, Ein Roitz Ela Salko Me'alav, like it says in Shabbos Tzaddik Gimel Amud Beis. I don't want the mace which is around, I only don't want which is a Yochid, is that's Malach Shentzit Lagufa. You made a petach, you don't need the petach, you only want to get rid of the pus, that's Malach Gufa. But if you push the pus, you drag the bench across your garden. To get from A to C, you don't have to get B. You don't need B to get to C. B happens as a side effect. That's Dovid she'eno miskaven. So again, if you must do B to get to C, you have to do B to get to C. But you don't want B. That's Malach Shentzit Lagufa. That's a Sofik Deraisa, a review of the Reb Shimon. But if you push the pus pimple, it's Dovid she'eno miskaven. It brings it down to a D'Rabbanan. And if it's Psikresha, now it depends if it's Nichle or Nochle. By the way, even though I didn't agree with you last week, there is a petach to what you said after Yasser Basher. We argued that it would be, you need the blood for the extraction. Then you try to say it's simultaneous, not simultaneous, we don't have to look into it. But either way, I timed it that it was Dovshin Miskaven, sick ratio, the Nichale. But maybe it's not, because it's Nichale for the patient, not for me. So the guy who's doing the malacha doesn't care, or does he care? So there's
It's in
an
my way. Bleeding's in my way until I'm finished.
it's even not good for me. Or no, my reputation is stake. He gets a dry sock and I look bad, whatever.
No.
Says
and when
they
you're finished, then you create bleed.
says the Egleital, are you allowed to urinate in the backyard on Shabbos? So it just depends
your
if it's
backyard or
good or
it's
it's not
backyard.
good. Very good. So assuming it's good for the plants. Assuming
And
you're
if it's
good.
your yard,
So he says nafkamina. If it's your garden, it's psikration, the nichale. But if it's your friend's garden, it's loyichmasle. You don't care. So it could be that here, that when you pull out the dude, you're doing the malacha.
Surveyors, like surveyor, I mean, numerous loafers involved in peeing in your backyard.
Okay, right. But it's Dov Shem Miskaven. I just want to go to there. Interestingly enough, there's a Rabbi Yaakov Emden in Erevin. It's a really murder Rabbi Yaakov Emden. They're urinating for Rosh Hashanah, Rosh Hashanah is also. And I said, wow, it's mamish go for it. It's like, I don't want to put my urine in across the fence. I don't want it in me. Says Rabbi Yaakov Emden Erevin, no. They used to use the urine for medication of the eye, and he needed it for a refuah. What forced Rabbi Yaakov Emden to say that? Because if not, it's really Lav Shetzim Lagufa. So he was talking in an open, he was talking in a case where they needed the urine for medical purposes. Yeah, we see the complexity. Ramosha, if you'll do us the honor and introduce us to the first three fundamental Yisodos of Shabbos. Well, we'll start with the first three. The first one is
He goes through just a number of different sources here from the Shulchan Aruch, basically all the places
Read
that
it,
you
read
find
it.
Or
We're
Chaim.
going to read the text. We're going to read the text.
Samanim really doesn't apply today because.
What doesn't apply?
Slichas Samanim I don't think applies today anymore because nobody can makes their own medication. The drug companies make it. It's all done.
So
Do we say kibbutz shabbat latam bot like zero? Do we say no? Alpha pi shabbat latam lo bot like zero. So we asked Rabbi Feinstein, I'll tell you a cute one if you bring up. First of all, the place could mostly say that we do hold this. So he said to Rabbi, when do we say kibbutz shabbat latam bot like zero? It doesn't apply anymore. Nobody knows how to fix a music.
Is there universal on that?
Like
No.
like
No, it's
eating
not
fish
No.
after.
So-
Every case is its own thing.
So when do we say that, or when do we say no? I'm going in the midbar, and even though I'm not allowed to ride a horse because I may pick a stick off the tree, but if there are no trees in the forest, I'm still not allowed to. Even though the time is not here, we still do. As Ramosha said, I'll tell you as follows: when the Chachamim gave the reason with the Gzera, it means it's contingent on the time. Bot la tam, bot la Gzera. But where the Chazal didn't give you the time, even though we know the time, but it wasn't given with the time, it shows it's not contingent on Fisha Bat Tam, Loy Bat Like Zera. So you say, how do we know which is which? It's very easy. When you see, we say Bat Tam, Bat Like Zera, it's the first one. We say Lo Bat, we know it's the other one. So we were in a catch-22 situation here. So
like
where does Shchika Somanim go?
My machonim for Melech Adonis.
Yeah, so do we do it or don't we do it?
It doesn't exist anymore, Melech
Okay, but still, most of the boys could say not like the Shulchan that we are choishish for my Machronim. In any case, the fundamental halacha basically is if you read the Shulchan Aruch, Mishesh Lemechus Realma. One way you can read it in English.
So in the
one way.
if you read in Hebrew, we'll say our own explanation of it.
Okay, whatever you prefer.
So okay, so he goes through basically Siman Shin Chav Ches, the Siman Shulchan Aruch in Hilchos Shabbos that goes through all of Hilchos Refuah. So he's going to pull out all the things here that are pertinent.
That we're going to work
to-
with over the next few weeks.
Yeah. Okay, so first one, this is the Sif Aleph, how it starts. Mishesh L'mechush Ba'alma. This is what Dr. Rosner was saying, the third category of just like a minor pain that doesn't qualify as a person is sick. V'hu mischazik v'holech kibari, but he's strong and walking like a regular person. It's a minor headache, but it doesn't impede his normal, his functioning. Also, lasos lo shum refuah, so you're not allowed to do anything. This is this gezerah that Dr. Rosner and Dr. Sir were talking about. The gezerah of shchichas v'manim is a separate isser that Chazal instituted to do any sort of of action of refuah. Even to let a non-Jewish person apply medication or something like that, gzeira mishum shchikas samanim is one of the gzeiras of Chazal. So this is number one, introducing us to the isser of refuah, independent of any other malacha and any other isser that comes up, of which there are many that we're going to see now. But just the act of applying a refuah is an isser on Shabbos. Okay, Siv Beis. Mishi yesh lo choli shel sakana, a person who has a cholish yeshu el sakana, like we've discussed tonight, things that anything can potentially lead to pikuach nefesh, and all these things are questionable nowadays with antibiotics or not. I used to learn with a doctor in Chicago that he used to say that when he was treating patients, many years ago, they used to die from strep. It was not an infrequent thing at all for a person to die from a strep throat, for it to develop
mastoiditis.
You die from tzavdina also. Tzavdina is the diphtheria. So diphtheria
We'll
is
see.
also a lethal
Major
disease.
discussion. What is
what's considered to be
tafidna?
a
Mishnah Berurah says bleeding gums. How many people do you know died from bleeding gums?
Well, diphtheria.
Well, scurvy. Well, we'll see. But okay.
Yeah.
We find different. Rabasha spoke about it at the Archicology this year. What is tafidna? Okay.
Mitzvah l'chalav l'Shabbos. So
Mitzvah l'chalav
that it's a
l'Shabbos.
mitzvah now. It's not just like the rules of Shabbos are suspended, but it's a mitzvah to go ahead and break Shabbos. So we'll see how this plays itself
Not
out.
only is it a mitzvah, but it's the Gedolei Yisrael should.
Oh,
Yeah,
that's the
right,
question.
let's
Is
see
it
right
better
now,
for?
not just
Well, we're saying, you can say right now,
people,
Vazar is Hareza Meshubach, a person who is zealous and does it quickly, so that's praiseworthy. Vashoel, a person who stops to ask a question, should I do it, should I not, what should I do? Hareza Shofech Damim. If it's a question of pikuach nefesh, it's a question of life and death.
You
So
act first and you ask later.
Exactly, right.
Is it better for a non-Shomer Shabbos to do the Yisr Malach or for a Shomer Shabbos to do the Yisr
We'll
Malach?
get into all. We'll get into this.
Right. This is what we're going to
I
discuss.
think
Yeah,
Rosh
that's the
Hashanah is
question.
very clear.
Should a frum
Yeah.
doctor try and switch Shabbos
That's
duties?
what we were in hospital.
Good, because
Rosh Hashanah says that for
the guy's going to do it
non-Shomer
anyway,
Shabbos,
or the non-religious Jew.
Rosh Hashanah is very clear.
Very
At least
clear.
the way I
How much
understood
Moshe
it.
argues
It's a
on
clear
it.
machlok. That's Moshe
180 degrees.
Yeah,
So you hear both. You can hear both out. When I was in Shari Tzaddik Hospital, Yom Kippur War, they sent them all the non-Shomer Shabbos on Shabbos. Only the Shomer Shabbos could be B'chal Shabbos. He knew why he was doing it. If it's non-Shomer Shabbos, B'chal Shabbos, not for the right reason, again I go back to Omerid, if you do the right thing for the wrong reason, is it called Chil Shabbos or is it called Shmir Shabbos? So Rav Shabbos Zalman held you were saying that
Said you better off for
the Jew should do it.
Shabbos, yeah.
And Rav Moshe said, what are you talking about? You can sit at the table with your children. He's Machal Shabbos anyway, and he gets a mitzvah. Why? He's doing it for on Shabbos.
And I think we can say that we're dealing with different mitzias here. We're here, basically all the doctors are Jewish.
Oh.
So over there, it was shaykh then when you were training the
So I had the
shift,
issue.
you were
In my
bringing in
residency
the guy.
program, all the residents were Jewish, not from, and the head of my department who was not from, Loyalaino's children were Chazar B'tshuva, but he was not from, and he said to me, listen, Marty, he said, you don't do it, they're Jewish too. Masamik Domi Didei, why is your blood better than their blood? And he had an argument. Okay, and what are you supposed to do? What are you supposed to do? Well, we'll have to learn.
There's plenty of Arab doctors around today.
So what? But maybe the Arab doctor will
So
not
they-
give the
they-
same
they-
attention.
Their blood
yes.
is redder than our
Right.
blood.
Yeah, that's
Our
good.
blood
It's
is
good.
redder
It's
than
good.
Is that an
Shabbos,
is that an
Shabbos,
issue?
Shabbos.
It's,
keep Shabbos,
right,
it's
it's
The Arab doctors have to keep Shabbos.
It's,
so that's it.
we
Yeah,
have to
if they
treat
keep
them.
Shabbos,
we
it's
have to
like
treat
Misa.
Is a Jewish doctor allowed to treat a guy on Shabbos? Politically correct, Dr. I see?
Absolutely.
Absolutely not. Medina, Zalacha, you're not. Lamaisa, you must. Why? Mishum Eva.
Eva, right?
Eva,
That's what
Mishum
I'm
Says it to Eliezer, beautiful Chiddush. When you treat a guy, he says, have in mind, I'm not doing it to treat him, I'm doing it Mishum Eva. It's a Malach Shen Tzich Lagufa. It takes the whole thing down.
It takes it from the Raisa to the
So the
Rabban.
Abanan, according to Shimon. Okay.
There's a show,
Anyway,
there's
you
a
see
show
the-
that's as much as we're learning the halachas and we're learning the problems, but if there's a sakana and a person
That
stops
you
to
do
look it
anytime
up,
that a guy
it's,
tells you do this or this on Shabbos or I'll kill you. So you have to say,
yeah.
I'm not doing it because he's telling me he's going to kill me and so on. I'm
it's
not
Eliezer
doing
says
it.
exactly the
Similar.
same. He says also about going. It's Eliezer.
And your Azores are Reza Meshuba.
And the show is
I always try to get out of being Mechal Shabbos. Like I can say in my career I never violated it. No. Chas v'shalom. There's a mitzvah to do it. This is Shabbos. The same God who gave you the Torah and told you to keep Shabbos told you, no, you don't keep Shabbos. The fundamental question is, the long discussion of Moshe Shapiro's are telling this. When a doctor does a malach on Shabbos, did the Torah tell him that he must be over an Isser? It's also to be a Chal Shabbos. And the Torah says you're mitzvah to be Mechal Shabbos. No. The minute Torah told you to do it, it's not Chil Shabbos. Did he do an Avera Beheter, or did he do no Avera at all? There's interesting dynamics here.
Speaks
Which
with
one
you,
is
say
it?
it'll come off the cup.
Yeah, of course, we're just touching.
Yeah, let's see them.
I think the discussion of Hutro Duchuya needs to be completely taken out and discussed separately and not.
I think he has it here. He sees it.
Rav Shlomo Zalman says none of this has to do with Hutronotcha. Big Chiddush. We all think, Al Pi Pashtos, that this whole thing has to do with Hutronotcha. So there's one thing I'm telling you up front. Even, and Rabbi Roshvai says this blanketly, even if we hold Hutcha, the same issues are on the table. Interesting. You have to hear it out.
Still needs to be a separate
Okay.
discussion.
Well, Moshe was clear Hutcha issue.
And isn't any mention of, it's a related issue about Malacha and Mikdash. Malacha and Mikdash is not Kayam. You go ahead and you do all those things and they're not
Good
considered
example.
a tzad of Isser whatsoever. There is a phenomenon of
For sure.
of a Jew, of a very religious person doing
Yeah, no,
this
Chaim says there's no
action
Chil
and it's
Shabbos.
not.
This is Shmir Shabbos.
So it could be.
Right, they're
it-
both,
it
they're
could be
smart both ways. You have to see how do we pass it. Go ahead. And what's an afkamina? Rav Moshe said, most people, Rav Moshe Shapiro said he can't understand this. Moshe Feinstein said, could be an afkamina if the doctor on Yom Kippur has to be mahar and tshuva. In other words, I did a mitzvah, I was obligated to a mitzvah, I ate tray. I asked you a question. Tshuva Sarajba. A kohen has a mace mitzvah. Does he have to be matami to mace mitzvah? Absolutely. He can pay somebody to do it instead of him, as the Rashba. The Ramah brings it. Doesn't have to pay him. It's mutter for him to do it. I ask you a question. Does the kohen become tummy? It doesn't remove his toma. He's not. It could be that when you eat Isser Beheter, if let's say you're a Bekuch Nefesh and you're eating treif on Shabbos, you're mechuyev to eat it. Is it matamtem? Yes or no? Right? Ramah says you shouldn't be yoinik from a goy, even though it's mutter. Why it's matamtem? Do we say that the Isser is still here or not? That's a whole issue. It's not for now. Let's go on to the third one, which brings these two issues to us now to the
Okay, so
forefront.
Sif Gimel also brings up the idea that we heard earlier about the idea of a makkah shel halal, like an internal makkah. So the Shulchan Aruch tells us, "Kol makkah shel halal," any internal injury, the hainu mehashinayim v'lifnim, v'shinayim atzmam bechlal. So we'll see that there's a whole discussion about this. But here the lashon of the Shulchan Aruch is that the teeth, from the teeth and inwards, and the teeth are included. So it would seem to exclude the lips and the gums are questioned, which we'll see inside the sefer. So in this mechalin alesa Shabbos, any internal injury, including in the teeth. So we are Mechal Shabbos. This is like what Rav Weiss was discussing here last week. Now that we know that an injured tooth or something is not going to be Pikuach Nefesh, that these halachas still apply. So that was what the topic was. But this is only if there's a certain type of an injury or a sickness that's inside. In other words, if a person just has heartburn or something, and we know the source.
Person has a
of the
canker sore,
pain,
an aphthous
right,
ulcer
the
on his
person-
tongue. Could he be Machal Shabbos? He's in a lot of pain.
Okay, so that's and in those situations, but again, a pain or a discomfort or something that is not so severe that it's potentially pikuach nefesh.
On Shabbos?
That's not considered to be a makkah. Says the
Gentian
Ramah,
violet.
mi
Gentian
shechoshe.
violet.
On Shabbos?
Wow, this is going to
be a biggie
very
for
big
us.
topic, right? We can get into it
not
now.
on
We
the
can wait till
Mishkan, I
he gets
guess
into it. But the Ramah adds in here specifically when it comes to teeth. And again, the Rav Weiss brought this up last week. The Ramah says that if a person has a very big pain in their teeth, so evidently it's a case where we know it's not a sakana. He just got through telling us that a serious toothache is a sakana. So then why
Even
does
if
he
it
need to tell-
is, the Mishmur says, because it's not a refuah beduka. Because pulling out the tooth is not for sure a solution.
Okay, it's one shot.
Do we
It's
still
one-
say this
that's
today?
fine, okay, yeah.
Do we, Rabbi Asher talked about this last
Yeah,
week.
that's what
Do
he
we still say this today, that we say it is a refuah beduka today?
Yeah. Okay, there's other mahalchim.
If it's not a full beduka, so what is it? It's a segula? If it's not a full beduka, so
It might be.
the alternative is a segula, which is an unproven therapy.
Right, maybe. It's not evidence-based. Do we only do on Shabbos evidence-based dentistry? There's only one problem. There's still no evidence that evidence-based medicine works better than non-evidence-based medicine. But that's move on, Meilov. You don't need evidence for that. Okay.
That's
so Sif
the
David-
Rambam in the Dorim, in the Spiritual Shas of the Dorim. Full beduka nusa means it went through scientific experimentation, and there was a good scientific basis to think that it might work and so on. as opposed to segula, which is unproven.
Says the Rambam in Pirkei Moshe L'Refuah in a letter to Galenius. I don't care how many people agree, even if they all agree, even if Galenius himself says it, I want you to analyze it scientifically, 1,000 years before scientific method. If it is true, accept it. If not, don't. Even if Galenius himself proposes that, for men speak to emotion, and you can't paskin halacha
That's
of
the
emotion.
25th chapter of Pirkei Moshe B'Refuah,
Okay.
where he criticizes Galen and Hippocrates, the so-called fathers of medicine.
He was very.
Unfortunately, this applies today as well. It takes 6 months to get erroneous concepts into the professional literature and 25 years to get it out, even when it works against our benefit. They finally just sued $2 billion. They took for the claim that dental floss does anything. For example, the only thing dental floss does good for are women who need to do it for chatzitza once a month. And so the companies have had to remove it. The ADA removed it from the book. All the claims, and we said this for years, so not everything they say, I apologize, is, oh, now, but for Shabbos, do we start doing every homeopathic, I get patients every day, well, you gotta do this for gum disease, do that for gum disease. I said, that's great, but I don't have evidence. I'm not saying it doesn't work, but one of the parameters for Shabbos. Go ahead, Rabbi Shah. Marcus Ocholo.
Okay, so this thing about a makkah shalchala, that's one of these internal injuries that a person is suffering from. It's an ena tzricha omed. It doesn't need a professional assessment from a doctor. Shafilu ein sham bekiyim. There's no doctor there. There's no expert in this. It's interesting. He doesn't say a rofe. He says a bucky. You could be a bucky in the sickness without being a doctor. V'chola eno omer klum, and the patient himself doesn't say anything. Even so, osano kol shrigin lasos lo b'chol. Exactly where Dr. Rosner quoted from. You do everything like you do as if it was Tuesday, as if it was a weekday. Even if we have no absolute knowing reason to do it, but the potential of pikuach nefesh that exists is enough.
But
for
this
us
was
to
one of the
do it.
challenges for me. This is talking to the layman. But we as doctors are supposed to know. So I can say to the layman, you're not a professional, you don't know. But what are we
he's gonna
supposed,
say
as
that right
doctors,
now.
what
He
are
says
we
right now.
supposed to say?
He says right now, "Aval kashi yodin makirin ba'oso choli shemamtin ve'ein tzarich chelo." But if let's say you do know there is a bucky there or a person who recognizes this sickness, and they say no, this can wait until after Shabbos. This is not going to pose sakanas, and it says also the chalav afal pishu makashol chalav.
So what would be a yardstick for such a thing? I think it's simple. Like what Dr. Rosner said, during the week, if somebody called you up at night, would you go rushing into your office without your staff and your equipment that you don't know how to use because it's so high tech today, or would you tell them, come in the morning? Not because you're tired or lazy, but you don't think that his life's in danger. You're a responsible professional. Well, do whatever you would do during the week. If during the week you might delay it, you know what? Your argument's both ways. Take antibiotics for 3 days. It depends how busy you are. When you're not busy, no, you got to take out the wisdom tooth because that releases it. And when you're too busy, no, it's better to take antibiotics for 3 days. It's a problem. There are ethical issues here now. I used to take out wisdom teeth all day until it became not worth it for me. Because I started doing implants, less time for wisdom teeth. All of a sudden, nobody needs it. So I bend over the other way. You don't have to pull it out. Nobody has to pull it out. So we have ethical issues. But on Shabbos, our yardstick would be what would you ethically, responsibly, what would your profession say is ethical and responsible on Tuesday to do or not to do.
Okay, so that again, but if you know, so just to make it clear, the difference is if in the first case, even if a person has heartburn, let's say, but they've never had heartburn before and they don't know what it is, and it's troubling them, and everybody around them doesn't know what it is, so then the mitzvah is to go be Machal Shabbos. But I'm saying that even if it's not a pikuach nefesh and it doesn't end up, but there's a mitzvah to go and to do it. It happened once. I told you, it happened once in a shul in New York that there was a person who collapsed in the front of the shul, like an elderly person. They had one of those Hatzalah phones, and a person in the back of the shul picked up the phone and called Hatzalah, and Hatzalah came, and it turns out that the person, it wasn't a heart attack or anything. The person just fell over and tripped on something, and the Rav of the shul, by mincha time that day, made a machav and said, that the person shouldn't have made the phone call until he figured out what happened. And they're like, all the other Rabbanim came out the next week and they said, no, that's totally wrong, absolutely wrong. The person did an absolute mitzvah. You see an older, elderly person, you see them fall over, and people say, oh, what happened? You don't waste a second. You bring Hatzalah, and, if it turns out it's nothing, it's nothing. But that extra minute of
So
waiting
my
to find out
father-in-law
could be
told me
different.
he's having
Yes,
pain in his
yeah.
lower left jaw. What would you think? Be Machal Shabbos, you can't be Machal Shabbos.
It's Makkah Shel Chalal. If you don't know what it is,
He
it's
ended up, he was in the middle of a massive heart
That's a
attack.
Makkah Shel Chalal.
One of the
It's the famous
first
Shel Chalal.
simonim is radiating pain to the jaw. So you can't make light. Yeah, it might be 1 in 1,000, maybe 1 in 100. But guess what? If you're not clear as to the source, you need to take
Exactly,
a picture.
that's
You need to
exactly.
see if there's something cannot do. It becomes Safek B'Kor Nefesh.
That's it. An internal.
He only had
thing
pain
that we
here,
don't
didn't
know.
have pain in the chest?
I wasn't there, I don't remember. But one of the main things he complained of was the radiating to the jaw. He was going like this. It was like even a couple of days ago. This really was becoming increasing.
Classic for acute
could be, right?
myocardial infarction, right?
Without chest pain.
Right.
Could be without chest pain too, right?
Even without chest
There you
pain.
go. Okay, one more.
But if we know what it is, we know
What
what
to
it is.
do?
That's quite important. This.
Well, there you go. That's over here.
But that's Makashov.
You're going down the hill,
I wanna say this,
and you don't know if you turn right or left or go
No, I know,
straight.
but you're saying good. I just want to make sure that we're saying that's not a chiddush. Based on what we saw, that's not a
Yeah,
chiddush.
but to us it is.
No, but I'm saying I'm saying the Shulchan Aruch says a makkah shel chalal is anything internal.
Yeah,
I don't know what it
that's
is, and
the
it's
pain,
severe.
isn't it? But
But
yeah,
it's
well,
severe. I have a severe pain in my thing. I don't know
You're
what the
not a
source
makkah
is.
shel chal, you just-
That's a makkah shel chalal. That's exactly what it is. I have a severe pain, something that's bothering me inside.
Makkah
That's not a
means
mechush
that
balm, and I
you look
don't
in
know
the
the
mouth
source
and
of
you
it.
have a draining pus.
It's talking my whole internal GI tract. I
Yeah,
can't
no,
look
I'm
in there
looking
and
in the
see.
mouth, I'm talking, right?
You can't see. I can't see in my jaw. I can't.
Okay,
I
so you
know- I
need to
don't-
know. You need to
I don't
know.
think that's a chiddush. I think that's straight out of Shulchan Aruch.
That's
That's a makkah shel
because you're
chalal.
not a
That's
dentist.
And I'm just saying, a makkah from inside
Sometimes
the
our
body is
routine
inside the
blinds
body.
us. We often miss a, God forbid, we miss a cancer because we're blinded by the routine. Periapical pathology, this is just an abscess. I had a woman, a wife of a Rosh Yeshiva in Eretz Yisrael. It's nothing. The next thing you know, she was in Sloan Kettering. She lost half her jaw. And thank God she's still alive today, 15 years later. It turned out she had something very serious. Is it rare? I always tell my patients, don't kill them by scaring them with a biopsy. I say, listen, in my 35 years, only twice was it anything. So the chance of being anything is, but it could be, and the responsible thing to do is to check it. Well, guess, in those two cases, we saved the person's life. So here too. If there's a possibility that it's life-threatening, don't be a machmer Shabbos, Reb Chaim says. Be a makel in Pikuach Nefesh. Come, do one more. What's it up?
Yeah, we'll stop.
Okay, so we will chug further. Next week, again, we have the great honor of having the author of the Sefer, Rabbi Dr. David Katz, will be joining us in Mir Hashem, which is a special treat. I think you get the books at Pomerantz. We'll bring these copies here for you. Please leave the ones that are here. We did have many copies, but hopefully it's available in Pomerantz or other.
Okay, I just want to make one quick message. We have one person that watched it. I sent it to quite a few on my list. So there's a medical doctor who does emergency medicine in Casablanca in Morocco at a World Cup soccer game, and he was listening to the shiur. So he thanked us. He said, really, thank you so much. Now I'm in
never know
Casablanca,
who you
Morocco, and I listened to the shiur, and he said, it was unbelievable.
So I want to tell you
so
a quick
big yeshur
story.
koyach, really.
How it's irrelevant. Thank you. This year I sent out Rosh Hashanah a little sefer on tefillas b'refuah. So people are sick, whatever. We all get 1,000 booklets. I got a call from a guy from England whose mother was found in Florida, 3 days on the floor already, almost dead. And he got on the plane Motzei Shabbos and he flew to Florida. And in his rush, he forgot to take with him a Tehillim. And was he grateful when he came in, he saw his mother got for me in the mail this booklet on Tehillim Refuah. He said, I went through the book 90 times. So even if there's two of us here in this Chabur, we already had 95 hits this week, and the Orthodox Dentist Club in America and around the world, it's time for us dentists, that Baruch Hashem was Zoichet to 500 pages of no fat. It's amazing. People say 500 pages in dentistry, and it doesn't even cover it all yet. It will give us insight into general halacha, medical halacha, dental halacha, that it behooves us to know. I already did. So it's floating around here somewhere. There was a copy left. Thank you, Dr. Rosner. You'll be with us next week?